Hey everybody, and welcome back to the Deep Dive. We're tackling something today that I know is super important to all of you listening: how we interact with patients and their families.
It's something we all deal with every single day.
Exactly. And, we always try to bring you the latest research and insights on this show, and, this Deep Dive is no different. We found some fascinating research, and I think you'll be surprised at just how simple but powerful some of these strategies are for seriously upping your patient care game.
It's so true what they say, right?
What's that?
It's the little things that make all the difference. And these skills are absolutely crucial for building trust and making those genuine connections with our patients that are so important.
Okay, so let's jump right in. This research kept coming back to this idea of a we're in this together approach with our patients. It makes sense on the surface, but how do we actually put this into practice day to day?
Well, it really comes down to those small gestures, the ones we often overlook because they seem so basic.
Like what? Give us some examples.
Sure. Think about it. A warm smile when you enter the room, using the patient's name, offering them your card.
Oh, and even just announcing that you're washing your hands before you examine them.
Yes, exactly. All these tiny things send a message of respect and help put people at ease right off the bat.
It's like you're setting the stage for a positive interaction from the get-go.
Right.
And I love that the research even mentions sitting at eye level with your patient whenever possible. It's such a subtle thing, but it can really shift the dynamic.
Absolutely. You're not towering over them, literally and figuratively. It feels less hierarchical, less like the all-powerful doctor dictating to the patient, and more like a collaborative conversation between two people.
And speaking of conversation, the research really drives home the importance of truly listening to our patients. I mean, we all know active listening is important, but in the thick of a busy day, it can be tough to really be present and listen.
Oh, tell me about it. And, we also have to remember that patients often come to us with so much more than just their physical symptoms. There's a whole backdrop of fear, anger, mistrust, anxiety, all the stuff that's bubbling beneath the surface.
So how do we as healthcare providers cut through all that and make sure we're really hearing what our patients are trying to tell us?
Well, that's the million-dollar question, isn't it? The research suggests acknowledging those underlying emotions directly. It could be as simple as saying something like, "I understand you must be feeling anxious about this."
Just validating their experience can make a world of difference. And it makes them feel heard and understood, which can really build trust.
Right.
Now, the research is also very honest about the fact that there are a lot of barriers to effective communication.
Oh, tons.
Yeah, we're talking medical jargon, time constraints, even our own personal biases and attitudes can get in the way.
It's true. And the research really pushes us to take a good hard look at ourselves and ask, what are my communication weaknesses? Because let's be real, we all have them.
Totally. And good communication is a skill like anything else in medicine. It takes practice, and it takes a willingness to pinpoint those areas where we can improve.
100%.
It's so easy to get caught up in the day-to-day grind and forget that communication is truly at the heart of what we do.
It really is. And speaking of getting to the heart of things, this research emphasizes over and over again the power of empathy.
Right. Meeting patients where they are with kindness and respect.
Exactly. And being sensitive to their cultural and educational backgrounds, too. And that might mean using interpreters when necessary. It's about making sure everyone has access to clear, understandable information.
Absolutely. And speaking of clear communication, we can't forget about families. Sometimes things can get pretty complicated when you've got a whole group of people involved.
Oh, for sure. That's when things can get a little hairy.
Yeah, and I found some of the practical tips in this research to be so helpful, like the idea of maintaining a single line of communication with large families. Basically designating a family spokesperson so things don't get too confusing.
Oh, that's smart. It streamlines things so much. Make sure everybody's getting the same information and everyone's on the same page. And of course, cutting back on medical jargon is huge too. We can't assume everyone understands those complex terms.
For sure. Sometimes it's like we need to explain things as if we're talking to a friend or a family member, not reading from a medical textbook.
Exactly. Metaphors, stories, even diagrams can be so helpful. The goal is to make complex information accessible to anyone, regardless of their background.
And one thing that really struck me was this point about encouraging questions. Sometimes patients might not even know what to ask.
Oh, 100%. We might need to prompt them a little. Think about what we would want to know if we were in their shoes and kind of gently guide the conversation.
Exactly. And then be ready to answer those unspoken questions that might be lingering in their minds. It's about anticipating their needs and being proactive.
And speaking of being proactive, have you ever used the explain back or teach back techniques? I find those can be super helpful.
I've heard of them, but I'd love to hear more about how they work in practice.
Well, they're all about ensuring patients really understand what we're talking about. With explain back, you as the provider summarize what you've understood from the patient, checking for accuracy.
So it's like saying, okay, let me make sure I've got this right. You're concerned about X because of Y, and you've been experiencing Z symptoms for about a week.
Exactly. You're mirroring back what you've heard to make sure you're on the same page. And then with teach back, it's kind of the reverse. You ask the patient to explain back to you their understanding of the diagnosis, treatment plan, or whatever it might be.
It's such a brilliant way to confirm their understanding, but also to give them a sense of ownership over their care.
Exactly. It's empowering. And when patients feel empowered, they're more likely to follow through with treatment, ask more questions, and really advocate for their own needs.
It sounds like both of those techniques really tie back into that sense of partnership we were talking about earlier. We're in this together.
Right. And they also play a big role in creating a safe and reassuring environment for our patients, which is another important point this research highlights.
Well, that makes sense because feeling safe and understood is foundational to everything else, isn't it?
Absolutely.
The research talks about helping patients regain a sense of positivity, reassurance, optimism, and control all those things that can really take a hit when they're facing health challenges.
Right. And it's not always easy.
Not at all. But the research suggests incorporating simple empathy statements into our conversations. Things like, I can see that this information has come as a great shock, or what worries you most about all of this?
Yeah, little things like that can make a world of difference.
It shows that you're not just a doctor delivering information, but a human being who genuinely cares about their well-being.
Precisely. And that human connection is what it's all about. It's about recognizing that each patient is an individual with their own unique needs and experiences. And, it's not just about the words themselves, it's about how we say them.
Our tone of voice, our body language, all those nonverbal cues can be just as important as the actual words coming out of our mouths.
Absolutely. I love that saying. People might not remember what you said, but they'll always remember how you made them feel.
So true. And speaking of remembering, this research talks about how valuable it is to give patients something to refer back to later, like some written materials that summarize the key points.
Oh, that's so important, especially when you're dealing with complex medical info. It gives them something tangible they can take home and review at their own pace.
And it can help counteract any misinformation they might have picked up along the way.
Oh, for sure, because let's face it, patients today are bombarded with information from every direction.
Anytime.
They're Googling their symptoms, reading online forums, getting advice from well-meaning friends and family. It can be so overwhelming.
It really can. It's like information overload. And that's where we as healthcare providers can really make a difference. We can help them navigate that sea of information and provide some much-needed clarity.
Exactly. By offering evidence-based resources and guidance, we can empower patients to make truly informed decisions about their health.
And that brings us right back to those explain back and teach back techniques we were talking about earlier. They're so crucial for ensuring patients really understand and retain the information we're giving them.
I've found those techniques to be game changers, honestly.
In what way?
Well, when patients feel like they're actively involved in the learning process, they're way more likely to remember what you've told them and apply it to their own lives.
It takes them from being passive listeners to active participants in their healthcare journey.
Exactly. And as we talked about earlier, empowered patients tend to have better outcomes. They're more likely to stick to treatment plans, ask questions, and advocate for their own needs.
So we've covered a lot of ground here. Communication strategies, empathy, empowerment, creating a safe and reassuring environment. What else does this research touch on?
One of the last big points they emphasize is the importance of follow-up and closure. It's about making sure patients know what the next steps are, how to reach you if they have questions, and leaving the interaction feeling like they've been heard and supported.
It makes sense. I mean, even after a really thorough consultation, sometimes those lingering questions or worries pop up later on.
All the time. So it's essential to be available for follow-up and to really try to end that initial interaction on a positive note. Something as simple as, I hope I've answered all your questions today, but please don't hesitate to reach out if anything else comes up.
Little things like that can really go a long way in building trust and making patients feel like they have a partner in their corner.
Totally. And it circles back to that we're in this together approach, which is really the foundation for all of these strategies we've been talking about.
It's interesting, isn't it? We often think of communication as this big, complex thing, but sometimes the most effective changes come from these tiny little tweaks we make to our approach.
I think that's so true. It's about being mindful and intentional and always looking for those opportunities to connect with our patients on a human level.
I agree, and this research does such a great job of highlighting those small but powerful strategies that can make such a difference.
I think so too. It's full of really practical, actionable tips and insights that listeners can start using right away.
Absolutely. But in the meantime, I would encourage everyone listening to take a minute to just think about your own interactions with patients. What's one small change you could make today to enhance communication and build a stronger connection with the people you care for?
Yeah, it could be as simple as making a conscious effort to make more eye contact, using the patient's name more often, or really actively encouraging them to ask any questions that are on their mind. Remember, even the tiniest adjustments can have a ripple effect and lead to much greater patient satisfaction, better outcomes, and honestly, a more fulfilling experience for both you and the patients you're working with.
Well said. So on that note, I think we're going to wrap up this deep dive into the art and science of patient communication.
It's been such a pleasure chatting with you all about these really important concepts.
Thanks for tuning in, everyone. We'll see you next time. And don't forget, you can find more information in the description. You know, as we wrap up this deep dive, it really hits me that so much of what we've been talking about boils down to really seeing the humanity in each patient we work with.
It's so true. Remembering that behind every chart and every diagnosis, there's a real person you know, with their own unique story,
Their own fears.
their own hopes and dreams.
Yeah, and they're often coming to us at a point when they're feeling really vulnerable, anxious, uncertain, maybe even scared.
Exactly. And that's when those communication skills become even more vital. When we can truly connect on a human level, we create that foundation of trust and empathy, and that can make all the difference in the world.
We're not just treating a condition, we're treating a whole person. And that means empowering them to be a part of their own care.
Right. To ask questions.
Advocate for themselves.
Exactly.
And when patients feel heard and understood, they're more likely to stick with those treatment plans
Engage in those healthy behaviors.
and ultimately end up with better outcomes.
It all comes full circle.
So as we wrap up here, what's one thing you would recommend listeners do today to start putting all of this into practice?
That's a good question. I'd say start by just paying attention. Notice how you're interacting with your patients. What's your body language like? Are you making eye contact? Are you really truly listening to what they're saying?
And don't be afraid to ask yourself that tough question. How could I be better at communicating with my patients?
Because we can always improve, right? There's always room to grow. And remember, even the smallest changes can make a huge impact.
Absolutely. And for those of you who want to go even deeper, we've got some amazing resources linked in the episode description.
Great stuff in there.
Definitely worth checking out.
For sure.
But most importantly, don't be afraid to experiment. Try some of these techniques and see what works for you and for your patients. It's all about finding what feels authentic to you while creating a more positive and supportive environment for the people you care for.
I think that's the perfect way to sum it all up.
Yeah, at the end of the day, it's about finding ways to connect, to communicate effectively, and to provide the best possible care for the people who trust us with their health.
Couldn't have said it better myself.
Well, on that note, we're going to sign off for today. Thanks so much for joining us on this deep dive into the art and science of patient communication. We'll see you next time.